Nothing makes a family nervous in the middle of the night more than a high fever. It's very important that we really understand what fever is so we won't be so fearful when things get a little hot. Listen closely because I'm sure there's some of these things that you were not aware of. What I want you to do is remember the 3 D's of fever management. First, detect the fever. Second, declare that it is a fever. And then third, do something about it. First, to detect a fever, we must be able to get an accurate reading of the core body temperature. The detection of fever in adults is very different from detecting a fever in an infant. For an infant, the best, most accurate temp is a rectal temperature. I know we don't like to do it, but it doesn't hurt the baby. The underarm method has shown to be so unreliable in infants, so you really can't rely on that reading. In fact, underarm reading is the pits, no pun intended. In older kids and adults, the oral temp is the most accurate temperature. Make sure the mouth is completely sealed to increase the accuracy. Next, we have to declare the fever. To declare, you must know what the true definition of fever is. Most people think that if you have a temp greater than 98.6, then that's a fever. Well, I'm so sorry to debunk that myth, but the true accurate medical definition of fever is defined as any temp over 100.4. Yes, you heard me correctly. So if your thermometer does not read 100.4, you don't have a fever. I don't care what your grandmother says. And I don't like it when folks say they have a low-grade fever. Having a fever is like being pregnant. Either you are or you're not. So in that way, either you have a fever or you don't. Ultimately, it's always important to determine the underlying cause of the fever, and you can leave that to the medical professional. The presence or absence of accompanying symptoms, a patient's medical history, and information about what he or she may have ingested. Any recent trips taken or possible exposures to illness help the health professional make a diagnosis. Special emergency cases of fever include a newborn 3 months or younger with a fever of 100.5 and over, and any young child with a fever over 103. Also, fever accompanied by severe headache, neck stiffness, mental confusion, severe swelling of the throat, or rash. If an immunocompromised person, such as a person with HIV or someone receiving chemotherapy or on steroids, has a fever, those are also emergencies. The last thing on your list is that you must do something about the fever. This means taking antipyretics, otherwise known to most folks as Tylenol or Motrin. These medicines come in all different types of formulations and strengths, and they can be extremely tricky to negotiate. Primarily, you should not give ibuprofen to anyone under the age of 6 months. Infants 0 to 6 months with fever should only take Tylenol. Also, it's important that you read the instructions on the box thoroughly and not just think that since you gave 1 teaspoon of medicine the last time your child got sick, and then when you buy another bottle, you should give that same 1 teaspoon. The amount of milligrams in medicine in each teaspoon of liquid varies greatly from manufacturer to manufacturer, so please always read those labels. For adults, you should always read the instructions as well and don't over-medicate. We tend to think if the directions say take 2 tablets, then we should take 3 tablets and the medicine will work faster. Please don't do that. These medicines in high doses can harm your liver and kidneys, so take them with water and a meal if possible, just to decrease the chance of you getting a bellyache. Follow the Hebert 3 Ds of fever and you won't be scared when things get a little hot at home. Keep it healthy with your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.